Hello, Aliveness family. We have missed you. Thank you so much for tuning in. Hopefully, soon we'll be resuming full services and have you back in the space. That's why we're creating this video, so that you can be aware of what is happening around COVID and how to prepare for when we gather together again as a community. What does that mean? That means three things: getting tested, continuing to practice recommended precautions, and of course, learning more about the vaccine. We hope you'll enjoy this video. It took a village, and we hope that you'll feel informed after watching. Y gracias a los hispanoparlantes por también ver este video acerca del COVID y cómo prepararse para cuando nos reunamos como una comunidad.
So, we've all been living in this pandemic for over a year now, and the first positive case in Minnesota was on March 6th of last year. And to date, the total number of cases in Minnesota is 500,000, and the total number of deaths is 6,824. So, what is COVID 19? Well, it's an infectious disease which is caused by a coronavirus that was not found in people before the pandemic. As doctors and scientists continue to gather new information, it's important to take COVID-19 seriously. Because it is such a new virus, we continually learn all of the negative effects that it might have. The symptoms of COVID-19 can include fever, cough, shortness of breath, chills, headache, muscle pain, sore throat, fatigue, congestion, and a loss of taste or smell. Other less common symptoms include gastrointestinal symptoms like nausea, vomiting, and diarrhea. These symptoms may appear 2 to 14 days after you're exposed to the virus. And not everyone with COVID-19 has all these symptoms. In fact, some people may not have any symptoms at all. Even after recovering from COVID-19, some people may have lingering symptoms such as fatigue, cough, or joint pain. The long-term health effects are still unknown, but there might be permanent damage to the heart, lungs, and other organs. This is more likely in those who had a more severe illness, but it is also possible when people have mild illness as well. Talk to your healthcare provider if you have questions or concerns about symptoms. Many of you may have heard about the variants that are out there of COVID-19. Well, variants are very common with a virus like COVID-19. Viruses constantly change through mutation, and a new variant of a virus is expected to occur over time. Multiple COVID-19 variants are circulating globally, and variants had first been detected in the United Kingdom, Brazil, and South Africa have all been detected in the United States. The UK and Brazil variants have been identified in Minnesota. The Minnesota Department of Health and its partners are actively testing for new positive samples to detect variants and learn more. Early indications are that new variants may spread more easily, but there is no sign yet that they are any different in terms of how sick people can get or how they affect any particular person. The impact of COVID-19 has been really rough on our community. Many businesses have been forced to close due to the economic impact. There's been job loss, there's been lockdowns and restrictions on movement, mask mandates, and health impacts, as well as the loss of life due to the virus. While vaccines become more available to the public and restrictions become more loosened, it's important to continue to follow the Minnesota Department of Health's guidelines on mask wearing and social distancing. Stay safe.
I wear a mask to protect myself as well as others from COVID. It's very important to wear a mask because if you care about other people and you care about their health and you care about your health, it's the simplest thing to do to make sure that you feel safe. And mentally, it's very uplifting as well because you know you're doing your part to end this pandemic.
It's important to wear a mask, wash your hands, and social distance to keep everyone we love and everyone healthy.
I wear a mask because it helps me to feel empowered to make healthier decisions to protect me and the community that's around me.
Es importante mantener la distancia social y usar máscaras para protegerse y proteger a las personas en tu vida. Es simple, lavarse las manos, social distancia y usar una máscara. Te lo digo con mucho, mucho amor.
What about HIV and COVID? Well, that's received a lot of attention, partly because some of the areas where there's a lot of HIV, such as New York City, were also hard hit by COVID. So we actually have pretty good data on this. So to review HIV epidemiology briefly, HIV is overrepresented in African Americans, Hispanics, the LGBTQ community, and in persons who are impoverished or poor. HIV rates are higher in those populations in the US and throughout the world. That happens to overlap with who's been at highest risk for COVID. So why would COVID concentrate in those populations? A number of reasons. One, less access to healthcare services and testing, so the virus can appear, people don't get tested, and it spreads more if persons aren't going to get tested. Persons of color who are relatively poor are more likely to have jobs that put them at risk. Health service workers, for example, bus drivers, factory workers, poultry, pork plant workers, etc. They're also more likely to live in multi-generation homes with more people. So if one person gets exposed at work, it can come in and basically disseminate the virus to the whole household. So those sort of multiplier factors have concentrated COVID in those populations, which tend to overlap with HIV. So again, it's a little hard to sort out, does HIV per se increase the risk? And actually the data has been somewhat reassuring, though there are some mixed results, but in general, persons with HIV that are on therapy doing well, defined as suppressed HIV viral levels and reasonable CD4 count, let's say over 200, have not been at particularly high risk due to their HIV. The risk is really related to the other risk factors for acquisition, which include those I just mentioned. How about if you get COVID and you're HIV infected, how do you do with that? What's your clinical outcome? And again, the data is somewhat reassuring. If you're somewhat otherwise healthy, under 50, not overweight, not a diabetic, no heart or lung disease, and you have good control of your HIV, the outcomes have been fairly similar to the rest of the population. Though if you don't have good control of your HIV, have a low CD4 count, have diabetes or overweight, already have underlying lung disease, or you're older, particularly over 60, 65, you're at increased risk for a bad outcome. So again, the risk has tended to be more related to the standard COVID risk factors and not HIV, but not having good control of your HIV and having a low CD4 count in some studies has basically put persons at higher risk for a bad outcome. And finally, what about the vaccines? How do you find out about getting the vaccine, which is very much recommended? And I should also mention that persons with HIV were included in the Moderna and Pfizer trials, and they did fine. We've been vaccinating most of our patients in positive care that are over 65, who are healthcare workers, live in residential settings, and not had a problem. I've had my vaccine, my kids have all had the vaccine. It's safe, please get vaccinated. So that's kind of my COVID summary for now. I may update this later in the year. Thank you for your attention.
I chose to get vaccinated specifically because I would rather know that I feel protected and have that kind of assurance as opposed to dealing with the possible long-term effects that can come from COVID. And as we're finding out more information, there seems to be a lot more lingering symptoms, such as I was reading an article about brain damage. So even if you don't trust a vaccine, the lesser of two evils, right? I would definitely choose to get vaccinated just to have that self-assurance and be more protected on that particular front.
I want to get the vaccine because that give me more freedom to travel. I will be safe around other people, and that will help other people to protect myself and others. But yeah, the fact that I can be more sociable, that is a big motivation for me. Yo me gustaría vacunarme para poder viajar y también porque para protegerme a mí mismo y a otras personas, el hecho de que si me vacuno puedo hacer una vida social más amplia, eso me motiva mucho. Gracias.
There are currently 3 different vaccines available: Pfizer-BioNTech, Moderna, and Johnson & Johnson. The Pfizer and Moderna vaccines are both 2-dose mRNA vaccines. The Pfizer vaccine requires 21 days between injections, while the Moderna vaccine requires 28 days between injections. The Johnson & Johnson vaccine is a little bit different. It's a viral vector vaccine that only requires 1 dose. All of these vaccines were designed to teach our immune system how to fight against the SARS-CoV-2 virus that causes COVID-19. These vaccines present the immune system with copies of the SARS-CoV-2 spike protein that is on the surface of the SARS-CoV-2 virus. When you get vaccinated, the spike protein is displayed on your cell's surface, where it is recognized by the immune system. After seeing the spike protein, the immune system basically says, "Whoa, this looks kind of weird and I don't think I like it, so I'm going to get rid of it." And then it spurs an immune response and creates antibodies that help to fight off the SARS-CoV-2 virus. Now, what's really cool about our immune system is that it creates something called immunological memory, meaning that it has the ability to quickly and specifically recognize enemies like the SARS-CoV-2 spike protein that it has previously encountered and subsequently initiate an immune response against those enemies. This means that after you get vaccinated, your body will be prepared to fight off COVID-19 infections. Now, all of these vaccines are incredibly effective. All 3 are very successful at preventing COVID-related deaths and highly protective against moderate to severe infections. Overall, the Pfizer vaccine is 95% effective at preventing COVID-19, Moderna is 94% effective, and Johnson & Johnson is 72% effective in the US. Early research also suggests that the Pfizer and Moderna vaccines can provide protection against the COVID-19 variants first identified in the UK and South Africa. The Johnson & Johnson vaccine also seems to provide protection against severe disease from the COVID-19 variants first identified in South Africa and Brazil. That's really good news. And vaccine manufacturers are currently creating and testing booster shots to improve protection against variants moving forward. Additionally, all 3 vaccines are very safe. They were expertly designed, carefully tested, and continue to be monitored closely. Now, after someone receives their vaccine, there is a good chance that they will experience side effects. Don't worry, this is completely normal. Basically, all of the vaccines on the market have some warning labels for side effects, so we'd expect much of the same here. Most people experience pain at the injection site, and many people have reported fatigue, fever, chills, and aches during their first 1 to 2 days after they received their vaccine. However, after those first couple of days have passed, you're out of the woods and starting to develop immunity. How cool is that? The next topic to touch on is a critical one: why it's important to get vaccinated as soon as you are eligible. Receiving the vaccine not only protects you from COVID-19, but it also protects those around you, your family, friends, and anyone with whom you are spending your time. If you get vaccinated, you are directly adding to the number of people in the community who are protected from getting COVID-19, making it harder for this disease to spread and contributing to the development of herd immunity. However, it is important to note that even if you're vaccinated, you should still follow COVID-19 safety guidelines like wearing a mask and social distancing. Right now, Minnesota is offering vaccines to a wide range of individuals. Make sure to check out the Minnesota Department of Health website and the Minnesota Vaccine Connector to learn more about where you stand in line for receiving your vaccine. And don't be afraid to ask questions. There are so many resources available, including our COVID team here at Just Us Health, that can help you to answer all your questions regarding COVID-19 and the vaccine. Hang in there, folks. Play your part by continuing to wear a mask, practicing safe social distancing, and following CDC guidelines. And, of course, please consider getting the vaccine as soon as you can. We are in the home stretch. The more we work together, the sooner we can return to normalcy, seeing our loved ones in person, continuing hobbies and exploring the world, and everything else that we've been missing. We're almost there. Thanks.
The decision to get vaccinated for COVID was an easy one for me because I believe in the science of vaccinations, which have a long history of safety and effectiveness. I look forward to the day that we can all hug each other and gather without face masks, and I believe that vaccination is the safest way to guarantee that future. La decisión de vacunarme contra el COVID fue fácil para mí, porque creo en la ciencia de las vacunas que tienen una larga historia de seguridad y eficacia. Espero con ansias el día en que podamos abrazarnos y reunirnos sin máscaras. Y creo que la vacunación es la forma más segura de garantizar ese futuro.
Hi everybody, we know COVID-19 is for real. For us to stay safe, we practice
social distancing, especially when you're in public, wearing masks, and washing hands as often as possible.
And also, if you have access to COVID-19 vaccination, please get vaccinated because all of us have been vaccinated. It's been tested, they know it works, there's no side effect, and please, we're encouraging everybody who has access to it to get vaccinated. Thank you.
You may be wondering how COVID has affected the Aliveness Project. And as you know, we've been able to transition our services to to-go meals and food shelf, and have been able to keep our doors open and serve members throughout the pandemic. And as we look forward to the future, we're looking at ways where we can start to slowly and gradually reopen and start to turn the dial to resume services to the point where we can open back fully. And as we start to slowly transition into that direction, we will be doing it in a way that will ensure that ensure the safety of our members and our staff as we continue to make progress with the pandemic. In addition, Aliveness is financially strong and stable. We've been absolutely grateful to receive the gracious support of the community throughout this past year, as well as additional funding and grants and support to continue to expand and serve our members and meet the needs of today and in the future. So thank you very much, and we look forward to seeing you all in this coming year.